Hello everybody, this is Dr. Sridhar, Vennamaneni at Prathima Hospitals in Kukatpally. Today I'll give you a brief update on the latest influenza infection that's been going around the country, causing a significant number of infections and a few deaths. The infection that I will be talking about is about the new H3N2 influenza infection. Now, typically this infection usually is confined to pigs. So we call this a swine infection for that reason. And when humans come in contact with pigs, sneeze or they cough, the virus is transmitted in the air, and the droplets, once humans inhale these droplets, they get infected with this infection. So the infection basically is transmitted from pigs to humans, and that's why we call it a swine infection. Now, the symptoms of this infection are similar to a COVID infection. Most of the symptoms are similar. Patients develop generalized fatigue, they can have a running nose, cold and cough, and usually patients will have high fever, at least 101 or above. They can have other symptoms including sore throat, they could have nausea, vomiting, diarrhea, but significant fatigue and muscle aches and cough, which is mostly dry. Sometimes you can have mild sputum, mostly white. The patients who are at high risk for this infection are patients who are younger, like small kids less than 5 years of age, patients above 65 years of age, patients with chronic medical problems like asthma, patients with diabetes, patients with heart disease, patients with kidney disease, patients who are on chemotherapy for cancers. These are all patients who are at high risk for this infection causing serious complications like pneumonia. If you look at the complications, the main complication is pneumonia, which can be life-threatening for some patients. So any patient who has fever, cold, cough, severe muscle aches, joint pains, and any other gastrointestinal symptoms should be tested, or they should see a physician immediately. Now, how do we prevent this infection? Prevention involves similar precautions like what we do for COVID infection. Since this is an infection that's transmitted through droplets, if you have patients who are infected and are coughing around you, if you have anybody with a cold and cough, or anybody with a fever around you who's coughing or sneezing, the droplets in the air, and once you inhale them or you touch them with your hands, and then you touch your face, those droplets have a high load of virus, and this viral infection can in turn slowly get transmitted into your upper respiratory tract and go down into your lungs. So the way to prevent this is, one, wearing a mask most of the time, and using a sanitizer, washing your hands thoroughly with soap, sanitizer as much as possible. Now, patients who have any kind of any of these symptoms of influenza like fever, cold, cough, muscle aches, these are people who need to stay away from work, they need to stay away from other people, they need to increase their fluid intake, stay at home and consult a doctor immediately, because there are treatments available. There is a medication called oseltamivir, which is an antiviral tablet, which works very good in the first 48 hours. If you take the tablet, the symptoms subside quickly and risk of complications is reduced. So any patient with these symptoms should immediately contact their physicians to see if they have influenza, because the sooner you're treated with this tablet, the better you'll be, because some patients can have a lot of fatigue which can last for weeks. Patients can have cough which can last for weeks, and lack of appetite, and some patients can develop pneumonia. So it's very important that if you have any of these symptoms like fever, cold, cough, muscle aches, you need to see the physicians immediately and see if you have these symptoms of H3N2 infection. Now, one way to prevent this infection also is there's a vaccine called a seasonal flu vaccine, influenza vaccine, which is quite effective. It prevents these infections in about close to 50 to 60% of cases. Now, we do have a lot of patients coming in every day here at Prathima with the similar symptoms with fever, cold and cough. Most of the young patients do fine, and complications are much less in these patients. But also a lot of patients start antibiotics before consulting us. They're already taking antibiotics with the very first day of fever, and then they come to us after 2-3 days saying that they've been on antibiotics and the fever has not subsided. So it's a viral infection and antibiotics have no role. So please don't start using antibiotics indiscriminately, because this in turn will lead to a unnecessary side effects as well as a lot of resistance. So my advice to you is, if you have fever, cold, cough, muscle aches, joint pains, any of these symptoms or any nausea, vomiting, diarrhea, please see the physicians immediately to see if you have this infection, because there is a tablet which, if taken within the first 48 hours, will make a big difference in your symptoms. Thank you.